Antimicrobial resistance. I want to first understand antimicrobial resistance.
In very simple terms, it's when medicines stop working. The medicines are supposed to work to treat the different conditions. But when these medicines cannot work effectively for what they're supposed to do, they cannot kill the germs, and this can happen for so many reasons. They are drivers. For instance, many times we self-medicate. You do not need an antibiotic, but then you go to a pharmacy and get it, and then treat yourself. You can share medicines at home. Probably you have been given medication, you take it and you don't finish it. And when it's someone else is sick in the family, you give them the antibiotics. Then other times, especially in Uganda, viral infections are not supposed to be treated by antimicrobials. But many times your child has a very simple cold or cough. They're given antibiotics. This process of why you're taking these medications when you don't need them.
At times, there are people who are given some prescription of drugs. And then when it fails to work, the doctors are like, let's try to change and use an alternative. Maybe we use other drugs, but still treating the same.
Sometimes medicines may not work for different reasons as well. But the first and most important thing is, has a test been done to actually confirm that you need such and such a treatment? Because there are also, like I talked about, the drivers. There are many drivers of antimicrobial resistance. And one of the drivers is actually the inadequate capacity of some healthcare professionals or health workers, and especially at the community level. And sometimes they may not know what they're actually treating because of the inadequate skills. And this results from the many mushrooming training, healthcare training institutions where we have half-baked people out there in different clinics doing what they are not supposed to be doing. That can also bring about the issues of inadequate, or proper treatment, which might bring up the issues that you're talking about.
What could be done in terms of the government policies to have this matter addressed?
Yeah, actually government has done a very good job, especially when it comes to antimicrobial resistance. We have a very comprehensive national action plan. The first one was in 2018 to 2023. Now we have a new one, 2024-2025 to 2028-2029, and which is focusing on 5 strategic objectives. One is on public awareness, then antimicrobial stewardship, then it is also looking at surveillance, research, and innovation. So in place, government has policies on infection and prevention control, standards, treatment guidelines on hand hygiene, infection prevention, and many others. But the whole issue, the challenge here is especially in terms of implementation at the facility level, as well as the community level. So
I can see in one of your releases here that the World Health Organization estimated like 1.27 million deaths globally, and in 2019 contributed nearly 5 million deaths. What is the case for Uganda?
In Uganda, we still have a gap in research to determine the extent of the problem. But different initiatives, especially as the National Action Plan is being implemented, research is being conducted. And I think then we'll have the real data regarding on the extent of the problem in our country.
In your view?
In my view? In my view, I think in a year we have over 5,000 people that are are related to antimicrobial resistance.
Oh.
5,000 plus.
Mm.
Yeah. For instance, I'll give an example. When someone is in hospital, someone has undergone a surgery, then they get an infection, and then they die. But this has been because, has been brought up, has been contributed by antimicrobial resistance. They'll say someone died when they were having, birth. Or if someone has cancer and then those medicines are not working, but it was because of antimicrobial resistance, they will still attribute that death to cancer, not necessarily antimicrobial resistance.